Welcome back, everyone. Dr. Brandon Colvin is with us today, general surgeon with Lima Memorial Health System. We're talking a little bit about appendicitis. You hear these, I guess, more noteworthy cases in the media talking about how quickly this comes on. But tell us first, what is appendicitis?
So the appendix is an organ that sits in your right lower quadrant of your abdomen, and it comes off your colon. Sometimes it gets inflamed, and that usually causes appendicitis. The most common causes are actually after being sick and from having a GI bug, constipation, and very rarely cancer can cause it as well.
Well, we talk about appendicitis. It does seem like it comes on quickly. Is that the case, or maybe we hear that and we've exaggerated a little bit, or are there signs as well to kind of look for?
Yeah, so appendicitis is a little bit tough. Sometimes it feels like a GI bug, but most commonly the symptoms are, again, right lower quadrant pain, sometimes fevers, and then chills. Eventually people can get nausea and vomiting if it gets really bad, and they can start getting pretty sick.
We get those symptoms you just mentioned. Is that the time to go to the emergency room?
That is correct, sir. You would want to come see the emergency department.
Yeah, don't mess around with that, because like you say, it can lead to real problems. Okay, so let's say the diagnosis comes in, we have to have our appendix removed. Walk us through that process and what happens there.
Yes, sir. So there's generally the gold standard now is what we call laparoscopic, which is where you put a small camera on your belly, go find the appendix, and actually pull it out, usually through your belly button. There's about 3 small incisions, give or take. There is an older way to remove it open. It's a bigger incision, a little bit longer recovery, more pain. So most people prefer what we call the laparoscopic or minimally invasive approach.
Yeah, and I think back to technology, even in the last 10, 20 years, where it makes it, as you mentioned, much less invasive. What's kind of the recovery time, especially now, compared to maybe a few years ago when this technology wasn't around?
That's a good question. So one of it depends on how sick the appendix is. So if it hasn't popped, then the recovery is actually pretty quick with the camera. Most patients are going to leave the same day, go home or walking. If it's perforated or popped, then we usually keep them in the hospital a little bit longer, just to give them a little bit more antibiotics to prevent the abscess and stuff like that you can get when all that bacteria gets out of your appendix. And then you're looking at open, which would be usually a couple of weeks recovery and higher chance of having complications. So relatively quick. Most of my patients go home that day or the following day.
Just out of curiosity, you mentioned this at the beginning, but someone joked with me once that the appendix is a vestigial organ that we don't need. Is that true? Does it have a function in our body?
Not that we know of so far. Yeah, they call it a vestigial organ, which means it's from evolution, and we don't really know what it does. We've studied it. We take out millions of them a year, and we still don't know what it does.
Yeah, I was going to say, the only time you hear about it is when we have to remove it. Dr. Colvin, thank you so much. I appreciate it.
You're welcome, sir.
Nice chatting with you. We'll be back right after this.